welcome to the Gastric Health Show. My name is Dawn Boxall and I am your host. So we are talking about how probiotics break down proteins into amino acids. So you guys already are the king of protein. You already know how important protein is. But most of you don't understand that, yes, you need protein, but you really need to be able to absorb and digest protein to really benefit. And if you don't get protein broken down to amino acids, you really aren't going to be getting the benefit that you're thinking that you're getting. So that's what I want you to understand, that connection. Digestion of food in general is two separate but very connected systems, and protein especially. So protein starts digesting in your stomach. So what happens when you eat meat, so chicken, fish, turkey, pork, beef, eggs, dairy, you name it, those start in your stomach. And your body has the ability to identify that, hey, we have food in here and we need some stomach acid and we need some protein enzymes, we need some fat enzymes, we need some carbohydrate enzymes. It can do that. It can identify those things. But weight loss surgery changes some of that. So weight loss surgery, it changes that stomach acid component. And it's all based off the parietal cells. And the parietal cells line the entire stomach. And when you removing that portion of it, they have the role of making the stomach acid or excreting the stomach acid. And if you don't even have access to that, then you sure as heck aren't going to be having too much stomach acid. You're going to have too little stomach acid. So you still have that other portion of the stomach that's stapled off that kind of can drain and hook up down to your intestines where you can still absorb nutrition from those acids and enzymes. It's just less. And so that's where we see lots of issues with, problems with digesting foods and absorbing and vitamin deficiencies and other things that occur. So first, the stomach acid. If there isn't enough stomach acid, then guess what? You don't signal your pancreas to release enzymes that actually digest carbohydrates and proteins and fats. It won't excrete it. If you don't have a gallbladder, then it's all in your liver. Your liver dumps it into your intestines, and it won't be signaled because that stomach acid, there isn't enough. So then you have this food that gets dumped into your intestines, and now your intestines are having to work overtime because it doesn't have enough of the raw materials to do the job, because the liver didn't send it, the pancreas didn't send it, and your stomach didn't do the job before. So now you have this environment in your intestines that you have undigested foods, and when you have that dysbiosis, then you aren't going to have enough of the enzymes to digest protein molecules to break them down into amino acid, which can then be transported into your bloodstream to be utilized throughout your whole body. It has some pretty big jobs in our body, and when that isn't happening like it's supposed to, and the amino acids aren't getting taken up as quickly because they can't be broken down and utilized from the food that's there, then guess what? You're missing out. When I approach this, when I have patients that I'm with, I'm either just prescribing some type of probiotic, depending on what they got going on, or I'm doing probiotics and digestive enzymes, or I'm doing just digestive enzymes because they're already on a probiotic. So either way, these two products are a mainstay for what I'm using to help patients improve their lab numbers, improve their energy levels. It's all about, not just about the number of protein you eat, but it's about the number of protein that you break down, digest, and absorb. So probiotics make enzymes that break down protein into amino acids. So if you don't have that bacteria, those good probiotics that can do that job, then your problem is magnified even more. So when you eat food, do you have diarrhea 30 minutes after you're eating or 10 minutes after you're eating? Maybe you're having lots of belly pain and your stomach hurts when you eat. It feels like a brick and you just avoid meat because it doesn't feel good. That could be lack of stomach acid. Just don't have an appetite for meat. That can also be a low stomach acid issue. So those are very, very simple symptoms that are very common with you guys that can easily be addressed with some simple supplements that you can take. Then there's 5 things that can shift it. So stress, medication, so antibiotics, and other steroids, immunosuppressants. Those can also impact that. But then also your exercise, your food choices, the environment, the toxins and stuff you're exposed to, all that can change what's happening in your intestines with the bacteria balance. So those things are going to be important to pay attention to, because if you don't have the right bacteria in your intestines, you are going to have those symptoms. How am I feeling when I have these protein foods and protein shakes? Am I not feeling good? Are they giving me a lot of gas? Are they giving me a lot of bloating or belly distension? Or am I actually having constipation? Am I having diarrhea? Those are all red flags that you are not digesting. So that's where we have to decide, do you need some support with the probiotics? Do you need some support with digestive enzymes? Do you need them both? What can you do? So my best advice is, 1, it's a no-brainer with a probiotic. There's already tons of evidence that shows you have better weight loss after surgery when you take a probiotic. Take a good quality probiotic. You'll see it at the grocery store. It's in bottles. You can buy it pretty much any grocery store now. And you can put that in protein shakes and smoothies. You can drink shots of it. You can also do yogurt. Not all of the yogurts that are out there are live active culture, so you need to make sure that. And then just get the best quality one. The next foods would be like fermented foods, so sauerkraut. At least try to do it once a day. And that will give you additional probiotics that you need and supplement the probiotic capsules that you can take. And that will give you a quicker rebound and a quicker way to benefit. Also, raw foods like fruits and veggies, raw fruits and veggies, those have enzymes in them naturally. So pineapple, papaya, kiwi, all those 3 are really good with enzymes. So they are beneficial. And it should be like a fresh pineapple, not the canned. It doesn't give the same benefits of enzymes and as a fresh does. And those would be great ways, simple ways that you could get in the probiotics and enzymes naturally just by your diet. And then I still recommend a probiotic for all of you just because of the evidence that's out there in your health and with weight loss. And also for protein digestion. I just feel like you need that boost, and you need just a really good one, broad spectrum, that covers lots of bases of different bacteria strains. In the meantime, at least start a probiotic and at least experiment in some fermented foods outside of yogurt. Be brave. Throw a little kefir into some of your liquid protein smoothies and boost it up that way. That's at least something more than just a straight smoothie.